Thanks everyone for joining us on this Saturday afternoon. So my talk today is going to be on heart disease in pregnancy during the COVID pandemic. Heart disease in pregnancy is an area that is seldom spoken of, and even till now, I work quite closely with the obstetricians and gynecologists in both all the Parkway hospitals, and we do recognize that heart disease now actually is a very significant issue in terms of maternal complications and all that compared to in the past. So heart disease in pregnancy is actually cardiovascular disease now is the leading cause of death in women during pregnancy, peripartum, postpartum period in most developed countries. It complicates about 1 to 4% of the pregnancies, and up to 30% of maternal deaths is a result of cardiovascular disease. So if you look at the graph down, this is from the American Action Forum. So about at least 30% of maternal complications and death is from cardiovascular disease. So why is the risk of heart diseases in pregnancy increasing? If you look at demographics and literature data throughout, a few reasons. One is that pregnancy nowadays occur much later in a lot of women, later in the reproductive years. And as such, therefore, a lot of them has got significant cardiovascular risk prior to pregnancy. Second is that the good work of our cardiologists, like Dr. Agate himself is actually a congenital, specializes in congenital heart disease as well. So they are very well, women with, or people with congenital heart disease are pretty much quite well looked after, and a lot of them progress actually with good survival to childbearing age. As well, the other area is in childhood cancer. So once this group of patients actually reach childbearing age and with pregnancy, they will have significant issues because of the underlying cardiovascular risk. Third, a lot of in the developed countries now, there's a significant increasing in terms of cardiovascular risk factors. So we do see a substantial proportion of young ladies with cardiovascular conditions, cardiovascular risk factors. So that, of course, put them at risk when they undergo pregnancy. And of course, lastly, with the increase in awareness and evaluation among medical profession, there's a higher pickup rates in terms of heart condition during pregnancy. So who are at risk of heart condition and complications during pregnancy? Young women with pre-existing heart condition that we mentioned. So there's a group of women with congenital heart condition now surviving to childbearing age. So if they have issue with heart function, a weak heart, they have issues with pulmonary hypertension, high pulmonary arterial pressure, and poor function, because this puts them at risk. Other medical issues that can affect the heart. So for example, childhood cancer, we're talking about patients who has received chemotherapy, who already has got some underlying LV dysfunction. So this group is another one. And of course, people with pre-existing cardiovascular risk factors, especially diabetes and hypertension. So this is from the ESC 2018 guidelines for cardiovascular diseases in pregnancy. This is an area that has been not well looked after for quite a long while, but lately now at least we actually have a guidelines that's up for managing this group of patients, our pregnant ladies with cardiovascular condition. So this is the modified WHO classification. It is probably the most accurate system now to to have a risk assessment on women with heart condition during pregnancy. So the ones that is being highlighted now, the ones in class 3 and class 4 are high risk conditions. So if women have got poor LV function, significant pulmonary hypertension, congenital heart conditions that puts them complicates them with pulmonary arterial hypertension. So all this as well, the other thing to note is actually moderate mitral stenosis, severe aortic stenosis. So all these valvular conditions as well, pre-existing, together with mechanical prosthetic valves, puts all this lady at high risk. So it's important to actually assess them preconceptionally to pick up this high risk group, so that prior to even conceiving, we do recognize that these women, when they go through pregnancy, will be high risk. In fact, in the class 4 group of women, they are probably not even suitable for pregnancy. So they have to be really picked up early, have a counseling advice, and let them know what we are looking at together with the obstetrician, even before they go into the pregnancy process. And up there are predictors of maternal and neonatal events. So you could see there, if there's a previous history of poor LV dysfunction, pulmonary hypertension, poor right heart function, all this already puts them at risk and should be picked up. So the next is actually the ROPEC and CARPREP risk predictors. So this is actually from large population studies. So this helps us to further refine the risk assessment. So in other words, if any of the women, when we go through preconception counseling, has got any of these risk factors, so namely poor heart function, poor functional class, on anticoagulation, and some of the other risk factors we see there, especially pulmonary hypertension. So this group of women, we've got to be very careful and work closely with the obstetrician when we hold their hands and monitor them through their pregnancy and delivery. So what are the common forms of cardiovascular disease that we see during pregnancy? So in this cohort study, you could see that the most common is arrhythmia, the group of women with congenital heart disease, and cardiomyopathy. And the other risk factors that has put them at significant risk if they have gestational diabetes as well as hypertension disorders during pregnancy. So at this point, maybe let's take a look at the cardiovascular physiological adaptation in pregnancy and why women, when they go through pregnancy, are extra risk of heart condition. So during pregnancy, there is actually significant changes in terms of physiological and hormonal adaptation, especially physiological adaptation, when the system has to support both the maternal and baby development. So there is a huge change in terms of hematological metabolic changes, and already these are at risk in terms of blood sugar, blood pressure, puts them at risk of cardiovascular risk. At the same time, there's significant hormonal changes, so there is increase in sympathetic activity very early from pregnancy, and there is also changes in terms of increase in estrogen, progesterone, and relaxing hormones, which actually drops the systemic vascular resistance. At the same time, the renin-angiotensin-aldosterone system undergoes a huge change as well. So you can see that with all these changes in the background, there's going to be significant hemodynamic changes in the body when women undergoes pregnancy. And a lot of times, if we do echo at this point of time, we actually do see that transiently during this pregnancy period, the left ventricle, there's an increase in terms of the thickness, the wall mass, and the cardiac chambers are dilated as well, which usually resolve in normal women with normal pregnancy once the delivery is over and postpartum. So what is significant to note here, so that we understand later on in the talk what we are going to expect in women with women with heart diseases during pregnancy who contracts COVID infection. So I think this it'll be good to understand what are the significant cardiovascular changes in pregnancy. So I think important to point out is that during the pregnancy, very early in the pregnancy, systemic vascular resistance actually drops. So with that, blood pressure tends to be lower than preconception value. The other thing that's significant is I mentioned just now, very early in the pregnancy, the sympathetic activity increases significantly, and this increases the heart rate at least by 25% over the baseline by third trimester. So what that does is that the heart rate increases, stroke volume increases, and the cardiac output increases significantly. And this can be up to about 45% by the end of the second trimester. And this honestly doesn't stop there. When the pregnant woman goes through labor, there is another increase in terms of cardiac output, up to 60 to 80% before the onset of labor. And then after the delivery, The early postpartum period, we'll see autotransfusion from the uterus and quite a few of the other physiological changes. And again, that further increase cardiac output. So it is actually very important during this period. So what happens, therefore, that pregnancy is actually likened to a natural cardiac stress test. So with that huge physiological changes, what happens is that a lot of women with underlying heart conditions actually get uncovered during that period of time. And the other important thing to point out is that, as we mentioned now, labor, delivery, there's huge changes. Most of the time, we do need to support these women and monitor them closely, even postpartum, at least early postpartum, to make sure that they are safe. So this study is actually an observational study from Canada, both the universities, Vancouver and Toronto, and they report that women do have, so these are a group of 1,300 women with underlying cardiac disease, heart diseases before they go through pregnancy. So overall, about 4% of the pregnancy were complicated by serious cardiac events, and this include heart failure, arrhythmia, cardiac death, and arrest. And what's important to point out is that most of this happens during antepartum period, and about half of this serious cardiac event actually can be preventable. 70% of these events are actually due to provider management factors. In other words, telling us that we do need to increase awareness among healthcare providers, especially obstetricians and cardiologists managing this group of patients, so that they could problems can be identified early and managed early to prevent bad outcomes. Okay, so with COVID-19, the SARS-2 coronavirus, so now it has already become a pandemic. At least 5 million deaths all over the world is caused by this, and it severely devastates our global economy. So with this disease, we know that with COVID-19 complication, the virus itself do affect and cause cardiovascular complications. So of course, you can imagine if the pregnant woman with heart disease is really at high risk, then if a pregnant woman with heart disease contracts COVID-19 infection, then this is going to be a very high risk group of patients. So how does COVID-19 affect the heart? COVID-19 virus can directly infect the cardiomyocytes. It can cause, it can spike off an acute inflammatory response, immune modulated response, and therefore in people who has pre-existing cardiac condition, heart failure, poor cardiac reserve, and plus pregnancy, that of course puts them at a very high risk. And what are the cardiovascular manifestations of COVID-19? So it could cause just by the virus on its own, with all the changes that I mentioned, mechanisms that I mentioned, can cause heart failure, myocarditis, immune response. It causes a thromboembolic state. So it could cause clots, pulmonary embolism, clots in the vascular system. It can spike off heart attacks, usually by a mechanism of thrombosis, and therefore complicates and cause complex arrhythmias. Usually, all this cardiovascular manifestation comes at the third stage, where the hyperinflammation changes happen. Honestly, maternal evidence or reports and publications on pregnancy and COVID is very little, very few publications, and even those publications are actually based on very small numbers. So this is very early in the initial stage of the infection. So this is a retrospective case series of about now 9 patients. When they are pregnant, they were diagnosed with COVID-19. And based on this, the mortality rate is very high. So it is a very small case series of only 9 patients in an Iran hospital. So out of which 7 died, and then the other 2, one of them was critically ill, ventilator dependent. The other one recovered after prolonged hospitalization. So this looks like quite dismal. However, if you look at all the other case reports, many case reports later on actually doesn't have as bad mortality. So from the CDC advice is that physiological changes in cardiorespiratory system during pregnancy actually does not directly increase the susceptibility to getting infected with COVID-19. But in pregnant women, because of we now know the background, the huge physiological change. When they have the virus, they of course will be at risk of worse outcome. So from the subsequent literature that we find, so actually it's not so bad in terms of outcome when pregnant women contracts COVID-19, but they are at risk of hospitalization requirement. They are at risk of severe illness, so that means they need ventilator support and a longer hospital stay. The prevalence is seen in US, UK, Spanish cohort, all small studies, is about 10 to 15% of severe illness. And those, of course, with underlying heart condition, risk profile will be much worse. The other thing that's important to point out that this group of women, the pregnant women, once they contract COVID-19, they are at risk of actually preterm labor. So these are two small studies that are just worth mentioning. So the first one is a Swedish study that looks at 2,000 over women, and it's being observed that women during pregnancy are at higher risk of preeclampsia when they are admitted in labor. The second study, just an interesting observation to bring up to share with everyone. So this is in China, and this study, out of all the women that has COVID-19 during pregnancy, is a high, unusual rate of cesarean section, about 93%. But if they actually tease out the numbers and look, very few of them has medical indication. So they are actually put for cesarean section because they have COVID-19. So this is the other interesting thing that I think is worth mentioning, that I think although pregnant women with COVID-19 disease will be at higher risk, but it doesn't mean that everyone needs to be put through cesarean section. In fact, cesarean section is not without risk. So by unnecessary doing the operation, actually it puts them through surgical risk of the cesarean section. Okay. So cardiac involvement in COVID-19 disease during pregnancy. Just a quick look at some of the literature that we have. Again, very, very small numbers of publication, but what I can find based on some of the publication. So first, this is a group of women. This study is done in the Iran hospital. So 154 women during pregnancy diagnosed with COVID-19 disease. So about 10% develop myocardial injury. And out of this 15 that develop myocardial injury, when they do an echo, the mean EF is about 35%, all in heart failure. So it's quite poor prognosis. They all have heart failure. They all have high cardiomarkers, biomarkers like TROP-T and biomarkers. And in fact, all the patients were admitted to ICU. 90% required intubation. 2 patients actually died. In this case, the 2 of them has gotten a malignant arrhythmia, and almost majority had to deliver prematurely. In contrary, this is a small cohort from 12 US institutions with critical illness, critical COVID infection. This group, unlike the previous one, actually has got no cases of cardiomyopathy. They didn't detect any cardio injury or maternal mortality, and there's 1 case of cardiac arrest. But compared to the previous study, the cardiovascular complication is actually much lower. Although one thing quite similar is that all these ladies, so pregnancy with COVID-19 disease, large proportion actually deliver preterm, prematurely during the admission. Okay, the last study that I want to bring up, this one is done in Mumbai. So again, this is not so much a study, it's more like a case series. So this give us a quick look on women with rheumatic heart disease as well as peripartum cardiomyopathy. But again, it's very small in terms of numbers. So there's three women with rheumatic heart disease, mainly mitral stenosis, and in 3 of them, and the last 2 is peripartum, meaning that they actually have got heart failure from their previous pregnancy. EF is about 20 to 35%. So among these 5 women, again, what is interesting is that none of them actually died from COVID-19. mortality is zero there, and in fact, none of them has got significant cardio issue. But again, premature delivery is the adverse outcome that is common in this group of women. So we can then therefore see that based on all the small publications we have, we don't have enough information really or knowledge at the moment with the potential effect of this COVID-19 virus on women with underlying heart diseases and what are the cardiovascular complications in this group of women. So it's limited. But then based on what we see is that a huge spectrum of cardiovascular manifestation has been described. So like I mentioned, the first study, heart failure, underlying subclinical cardiac injury from raised biomarkers. So there's a huge variation in terms of information among all the different cohorts. So of course, looking at the small numbers, a lot may be complex or confounded by the fact that it's on different population, the care is different. So for example, in one of the studies from Dominican Republic, the women there actually do not have access to care. And the one in Mumbai as well, they have been delayed in terms of referral. They don't have access to the care, and they don't have access to the medications called COVID-19. So of course, all these were confined. But I think what is important from all the studies that is put forth is that women with heart diseases in pregnancy already is a very high risk group in terms of physiological changes. And when they get COVID-19, like I mentioned, that there's a high chance of cardiovascular complication that puts them at extra risk. Therefore, what is important is that when we see pregnant women with underlying heart disease and when they contracted COVID-19, I think it's important clinically to pick up signs and symptoms. So a lot of, if we look at the presentation in terms of signs and symptoms, there's a lot of overlap between COVID-19 disease, heart failure, and even normal pregnancy. Some of the symptoms are also present similar to heart failure. So, but when we pick up symptoms in this group of patients, I think what is important to be aware is that we evaluate them early so that we don't miss out COVID-19 disease. And if there is, then we have to watch them quite closely. So although there is limited information, but we quickly go through. So with the impact of physiological changes during pregnancy that we have spoken about, so obviously if the patient, the pregnant lady actually has got the pre-existing heart condition, we have to watch out for certain complications. So first, during pregnancy, there is significant changes in cardiorespiratory system. So for example, there will be a decrease in total lung capacity, chest compliance towards the end of the pregnancy. So you can imagine that in a woman who has pre-existing pulmonary hypertension and pulmonary disease, if the pregnant lady actually contracted COVID-19 pneumonia, so that will cause which potentially can cause diffuse complication, or that they will be, of course, at risk of poor outcomes. And women who has got pre-existing moderate mitral valve stenosis or congenital cyanotic cardiomyopathy, issues with pulmonary hypertension, significant. So this group of women, of course, we can imagine that COVID-19 actually can result in cardiac injury. So with a pre-existing condition like that, and then during pregnancy, when there's a huge change in physiological changes, we got to watch out for heart failure, and pick them up early so that we can manage. The other issue with COVID-19 is, of course, systemic coagulopathy. Pregnancy, like we mentioned just now, is a natural hypercoagulable state. So in someone in a pregnant lady who actually contracted COVID-19, and also especially with a background of mechanical valve prosthesis, AF, rheumatic heart disease, these women got to be watch out for thromboembolic events. And then the other thing that is important is that, again, on the background of thromboembolic risk, we got to watch out and make sure that we don't miss out acute myocardial infarction. So ladies, the chance of thrombosis is of course not as high at this stage, but the other less common things that we have seen and should be watched out for, which will still present as acute coronary event, will be that of spontaneous coronary arterial dissection, coronary thrombosis, and some ladies microcirculation systemic disorder as well. Hypertension disorders. So if we look at pathophysiology and mechanism wise, so we do know that the the coronavirus actually enters the system through the ACE2 receptor. And this is also the receptor that is a key player in blood pressure circulation. And in women with preeclampsia, we do know that there's a lot of variation in terms of the renin-angiotensin system during the pregnancy period. So of course, there is no data at the moment whether women during the pregnancy are at risk with COVID-19 are at risk of preeclampsia or hypertension. But of course, we can easily see that there may be a relationship there. And therefore, pregnant women who has got hypertension going through pregnancy and worse if contract COVID-19 will be a high-risk group and should be evaluated closely and monitored closely for poor outcomes. And in this group of women, I think some cardiovascular management consideration during labor. So we just now highlighted that during delivery and labor, there is a huge physiological change in terms of cardiac output. So during this period is a time when if any of the pregnant women with heart condition contracted COVID-19 and goes through labor, this is a time where we have to work quite closely with the obstetrician so that timing of the delivery, mode of the delivery, and sometimes even include the anesthetist to watch them closely during the delivery process. And in any of these women, I think it's always it's always important to do the cardiac biomarkers early so that we can, and also an echo if possible, so that we can gauge whether there's underlying worsening in terms of myocardial injury and the heart function. And importantly, I think if possible, monitor closely and treat early so as to improve the outcome. So this is a statement that's issued by the British Cardiovascular Society and UK Maternal Cardiology Society. It is a statement to warn that in women with significant heart condition, so the higher risk group is this list of conditions. So in any of these women are pregnant and actually has got a background of significant coronary artery disease, valvular disease, pulmonary arterial hypertension, some of the congenital heart disease, and hypertensive heart disease as well. So this group of women preferably should be shielded for the first trimester during pregnancy, meaning that they should cut down on going out, social distancing. In fact, even they advise that even cut down on unnecessary medical clinics visits and all that, so that they can cut down the risk of contracting COVID-19 disease as much as possible. So, although we don't have enough evidence at the moment to give us clear guidelines on what exactly to do for this group of women, high-risk women during the pregnancy process. But I think what's important is that during this pandemic, if we have any lady with underlying heart condition who is thinking of going through pregnancy, I think it's important that they go for a pre-conception evaluation. So with cardiologists as well as obstetrician together, it will be good to do that so that we know we can do the risk assessment like what I mentioned earlier on to identify and let them know how high the risk is. So that throughout the pregnancy, we can then speak to the patient and identify what are the possible complications that can occur. And then when the patient gets pregnant during the pregnancy, they need to be closely monitored both by the obstetrician as well as the cardiologist. During delivery, then this so-called pregnancy heart team needs to work together to make sure that the delivery process can be as safe as possible. And early postpartum, again, they do need to be monitored closely and managed promptly if there's any complication. So to conclude, severe consequences of COVID-19 disease, together with complications in this group of pregnant women with heart diseases, could result in poor maternal outcome and at the moment uncertain prognosis. So we don't have much evidence in the literature now, and we definitely need more to allow us to have a better understanding on the potential effect of COVID-19 virus on this group of pregnant women with heart diseases. But I think what the take home is that what would help them at this juncture is that all of these women should go for preconception counseling and have a clear assessment of their risk if they go through pregnancy and touch wood contract COVID-19, and so that prompt management can be ensured on this group of patients. With that, I thank you very much.